Hello. I'd like to begin by thanking you for taking the time to attend this in-service of Baxter's Vial-Mate adapter. For the next few minutes, I'll describe this product. The Vial-Mate adapter is a reconstitution device to be used only for single-dose powdered drug vials with 20 millimeter closures and 50 milliliter, 100 milliliter, and 250 milliliter ViaFlex containers. Let's begin with the blister pack. On the back of the blister pack, you'll notice two arrows in the upper left-hand and right-hand corners, which is where you will peel the package open. Below is the product code number, which identifies this product for ordering purposes. Next is the name of the product and cautions. At the very bottom is the lot number. Should you experience a product quality problem, please contact Baxter's Product Surveillance and identify the unit by this number so we may investigate. Now, let's discuss assembly. Docking can be done inside a laminar flow hood. However, this is not required. It may also be done in any area that would meet your facility's requirements for aseptic technique. Remove the cap from the drug vial and disinfect the stopper. Peel open the blister pack from either corner and pull towards you. Remove the Vial-Mate adapter from packaging. If the foil seal is compromised, do not use the product and contact Baxter's Product Surveillance. Remember to use aseptic technique during assembly. To attach the Vial-Mate adapter to the drug vial, place the vial upright on a flat surface and hold the white vial gripper firmly. Push the vial gripper straight down until the vial snaps into place. Do not twist. Check to make sure the vial is securely attached by pulling the vial straight down. Do not twist the vial in device. Next, remove the foil seal from the other end of the adapter. Note that the area under foil is sterile, so use aseptic technique. Disinfect the medication port on the ViaFlex container, then hold the blue port adapter just beneath the seal flange collar. Push the medication port straight into the blue port adapter until the seal flange collar touches the container. After assembly, but before activation, if the Vial-Mate adapter is attached to a 50 milliliter container, it can be stored for up to 15 days at room temperature. If a 100 milliliter or a 250 milliliter container is used, the product can be stored for up to 30 days at room temperature. Finally, if the Vial-Mate adapter is attached only to the vial and the foil seal remains intact, it can also be stored for up to 30 days at room temperature. The next step is activation. To activate the product, hold the vial gripper and port adapter assemblies firmly. Twist slightly to align the ribs of the blue port adapter and white vial gripper. Push the blue port assembly into the white vial gripper until the seal flange collar meets the white vial gripper. The final step is reconstitution. Hold bag with vial down and squeeze solution into vial until half full and shake to suspend drug in solution. Then, invert the bag and hold it with the vial upside down and squeeze the bag to force air into vial. Release to drain suspended drug from vial. Repeat these steps until vial is empty of drug and solution is thoroughly mixed. Ensure drug is completely dissolved. Do not remove Vial-Mate adapter and drug vial. Once reconstituted, the drug must be used within the specified time for drug stability according to the manufacturer's package insert or the remainder of the previous expiration date, whichever is shorter. To administer the product, remove the port protector and attach an administration set per its directions. Hang container on IV pole and prime set per directions. Warning: do not use flexible plastic containers in series connections. Baxter, ViaFlex, and Vial-Mate are trademarks of Baxter International, Incorporated.
Hello, I'm here today to demonstrate our Minibag Plus container drug delivery system. The Minibag Plus system is a manufactured, prepared, point-of-care activated system that helps reduce the potential for needle stick injury and assure easy identification of administered drugs. There are two components to the Minibag Plus system: the container and the vial adapter. The container is the same as a conventional mini bag container. It contains either a normal saline or 5% dextrose diluent solution and is available in either 50 or 100 milliliter sizes. The administration port connects to standard IV tubing and is shielded by this blue tip protector, just like a conventional mini bag container. An important feature of the Minibag Plus container is the unique vial adapter. The adapter connects to single-dose powdered drug vials with a standard 20 millimeter closure. The adapter is sealed with a foil cover and connected to the bag by this port tube, which has a blue breakaway seal inside. This seal prevents mixing of the diluent with the drug powder until you choose to activate it, which helps maintain the stability of the product. Now, let me show you how to dock a drug vial to the Minibag Plus container. Docking can be done inside a laminar flow hood. However, this is not required. It may also be done in any area that would meet your facility's required aseptic techniques. First, remove the vial's cap and disinfect the stopper using proper aseptic technique. Place the drug vial upright on a flat surface. Next, peel the foil cover off the vial adapter. Always check the interior of the adapter to make sure it is free of excessive moisture, which is more than a few drops. Squeeze the bag. If liquid appears, either at the container itself or inside the blue vial adapter, the integrity of the product may be compromised. In this case, you should not use the product and you should contact Baxter Product Surveillance. Holding the drug vial with one hand, grasp the vial adapter. Push the vial adapter down onto the vial until you hear a snap, which tells you the connection is tight. Do not twist. To ensure the vial is fully seated, pull on the vial to test the connection. You may notice that the vial will wiggle a bit after making the connection. This is normal because the adapter is designed to accommodate slight differences between the vial specs of various drug manufacturers. The locking ridges inside the adapter keep the vial from detaching. After docking and prior to activation, most products can be stored for up to 15 days at room temperature. However, there are some drug vials, when docked with 100 milliliter containers, that can be stored for up to 30 days at room temperature. Drug reconstitution or activation is typically performed at the site of patient care just prior to administration. Before reconstituting the drug, first squeeze the bag to check to see if the vial is fully seated and the drug powder is dry. If the container is leaking, the vial became detached from the adapter, or the powder is not dry, do not use the product and contact Baxter's Product Surveillance. First, snap the blue breakaway seal that is inside the port tube to allow diluent to flow into the drug vial. To do this, bend the seal forward about 90 degrees and then backward about 90 degrees. Then, holding the system with the vial down, squeeze solution into vial until half full. If you fill the vial completely, it will be difficult to get the liquid out again, so don't overfill the vial. Shake to suspend drug in solution. Next, invert the system so that the vial is on top and squeeze and release the bag several times to force air into the vial. When you release, the reconstituted drug will flow back into the bag. If some drug powder remains in the vial, this process can be repeated until the vial is empty of drug and the solution is thoroughly mixed. Once activated, the drug must be used within the specified time for drug stability according to the manufacturer's package insert or the remainder of the previous expiration date, whichever is shorter. Then, proceed with setup and administration according to your hospital's protocol.